Best natural remedies for restless leg syndrome. Restless leg syndrome, also known as Willis-Ekbom disease or R.L.S., is a condition that causes uncomfortable sensations, most often in the legs, which normally occurs in the evening or during the night after you've settled down to sleep. These sensations have been described as tingly, crawling, creeping feelings, and cause the overwhelming urge to move the affected limb. You may feel like you can't stop your legs from jumping, or it may feel like a tingle that travels up and down the back of your legs or through your feet. It's generally more annoying than painful. The sensation can vary from one person to another. The movements caused by R.L.S. are called periodic limb movements of sleep or PLMS. Because of these movements, R.L.S. can cause serious sleep problems. Methods of treatment are varied, as the root cause of R.L.S. isn't truly known. Some research suggests that R.L.S. is caused by problems with the brain chemical dopamine, or that it's related to poor circulation. R.L.S. can lead to anxiety and depression. The longer you have the condition, the worse it can get and can even spread to other parts of your body, such as your arms. Traditional medications may become ineffective with time, and some are potentially addictive, with side effects that may become more uncomfortable than the sensation in your legs. Natural remedies can be safer and perhaps more effective over time. A period of trial and error will determine which ones are most effective for you. Some of these you can try on your own. Others you can discuss with your doctor, who can help you create a treatment plan to help relieve your R.L.S. symptoms. So what natural remedies are effective for restless leg syndrome? Ruling out potential causes. Try to figure out if something is causing your R.L.S. While R.L.S. can be related to things that are largely out of your control, such as genetics or pregnancy, other possible factors can also cause symptoms. These could be daily habits, medications you're taking, health conditions, or other triggers. The use of caffeine, alcohol, and tobacco can aggravate R.L.S. symptoms. Limiting these substances could help reduce your R.L.S. symptoms. Iron deficiency and vitamin supplements. Iron deficiency is one of the leading causes of restless leg syndrome. Correcting an iron deficiency may involve receiving iron supplementation orally or intravenously. However, take iron supplements only with medical supervision and after your doctor has checked your blood iron level. A simple blood test can check for iron deficiency, so if you think this could be a problem, talk to your doctor. This makes improving your diet to include more iron-rich foods or taking a daily supplement the best natural remedy for the condition. In addition, vitamin D deficiency could be linked with R.L.S. A 2014 study found that vitamin D supplements reduced R.L.S. symptoms in people with R.L.S. and vitamin D deficiency. And for people on hemodialysis, vitamins C and E supplements may help relieve R.L.S. symptoms. If you're experiencing uncomfortable sensations in your legs and feet in the evening or nighttime, firstly discuss the issue with your doctor and request the proper test to check your iron levels and rule out other nutrition deficiencies. Eliminate caffeine. Many people find that caffeine intake correlates to more restless leg activity in the evening. Sometimes cutting back on caffeine may help restless legs. Try to avoid caffeine-containing products, including chocolate and caffeinated beverages, such as coffee, tea and soft drinks, for a few weeks to see if this helps. Essential oils. You can try essential oils for restless leg syndrome. Many people have found some essential oils helpful for the relief of this condition. Peppermint essential oil. This oil has natural anti-inflammatory and anti-spasmodic properties and is often used to calm aching, sore muscles and joints. Mix it with almond oil, coconut oil, olive oil or another carrier oil, and then apply it directly to your legs for maximum benefits. Test on a small patch of skin to make sure it doesn't irritate first. Give yourself a gentle massage as you go, and the aroma may lift your mood as well. Lavender essential oil. This is one of the most soothing aromas in nature, so it's an essential component of every healthy bedroom. Add a drop or two to your diffuser and allow it to calm your mind and relax your body. This complete relaxation can help you sleep and hopefully get you through the night without irritated legs. Sleepy legs. This blend was created by Eden's Garden aromatherapists to soothe jittering legs and thoughts, and to help you to drift off into a peaceful night's sleep. Blend: 35 drops lavender, 25 drops Roman chamomile, 15 drops clary sage, 15 drops sweet marjoram, 10 drops patchouli. Add this blend to a 5 ml stock bottle. Dilute to 3% and massage onto legs before bed. For added relief, diffuse this blend for 30 minutes before bed as well. Alternatively, combine 6 drops of Sleepy Legs with 1 ounce of carrier oil and 1/3 cup of Epsom salt. Add to a warm bath, and soak your legs before bedtime. Hot and cold compresses. Use of heat or cold, or alternating use of the two, may lessen your limb sensations. Some people find that heating pads help while others prefer a cool compress placed around the legs. Consider investing in a good heated blanket to keep the heat on your legs throughout the night, if you find that heat works best. Gentle massage. Massaging your leg muscles could help ease your R.L.S. symptoms. Lightly massaging your legs or feet before bed can help ease the muscles and prevent some attacks. Massage can also aid in relaxation, which could help improve your sleep. Soaking in a warm bath while massaging your legs can relax your muscles. Weighted blankets. These blankets were originally designed to help people with autism, anxiety and other disorders, but they're now being used for a growing list of medical conditions. They are designed to place added weight over your body with equal weight distribution. Weighted blankets are also calming and may help many people fall asleep faster and stay asleep longer. Morning exercise. Morning exercise will naturally increase blood circulation through your legs and feet, and can help tremendously with restless leg syndrome. Exercising too close to bedtime though could actually lead to more restless sensations in the legs, so exercise in the morning or early afternoon. One recommendation from the Restless Legs Foundation: exercise in moderation and don't work out to the point of aches and pains, as this could make your R.L.S. symptoms worse. Getting moderate, regular exercise may relieve your symptoms of R.L.S. Yoga and stretching. Yoga and stretching exercises have been shown to have benefits for people with R.L.S. Studies have shown that stretching exercises make significant improvements in the R.L.S. symptoms of people on hemodialysis, and can also help improve your mood and reduce your stress levels. Try adding some calf and upper leg stretches to your daily exercise routine. Establish good sleep hygiene. Having good sleep habits is advisable for anyone, especially for people who have trouble sleeping, such as those with R.L.S. Fatigue tends to worsen symptoms of R.L.S, so it's important that you practice good sleep hygiene. Ideally, have a cool, quiet, comfortable sleeping environment, go to bed and rise at the same time daily and get adequate sleep. Healthy sleep habits. While sleeping better may not resolve your R.L.S. symptoms, it could help you offset the sleep loss you suffer from your condition. Try the following tips to make your sleep as restful and restorative as possible. Try to keep your sleep area cool, quiet, and dark, and keep distractions, such as the TV and phone, to a minimum in your bedroom. Foot wrap Restiffic. Using a foot wrap has been shown to help relieve R.L.S. symptoms. It is called Restiffic. The foot wrap puts pressure on certain points on the bottom of your foot. The pressure sends messages to your brain, which responds by telling the muscles affected by R.L.S. to relax. This helps relieve your R.L.S. symptoms. The only problem is the Restiffic foot wrap requires a prescription and an initial monetary investment, but could provide R.L.S. relief. Pneumatic compression. A PCD is a non-drug treatment that can be bought over the counter or with a prescription. It could help relieve your R.L.S. symptoms by improving circulation in your legs. Pneumatic compression is used in hospital. This treatment uses a sleeve that goes over your leg and inflates and deflates, gently squeezing and releasing your limb. It is typically used to improve circulation and prevent blood clots. Improved circulation might also be the reason pneumatic compression has been shown to help relieve R.L.S. symptoms. Vibration pad Relaxis. The vibrating Relaxis pad requires a prescription. It may not treat actual R.L.S. symptoms, but it could help you sleep better. It is used while resting or sleeping. You place the pad on the affected area, such as your leg, and set it to the desired vibration intensity. The pad vibrates for around 30 minutes and then shuts itself off. The idea behind the pad is that they override the uncomfortable sensations caused by R.L.S. so you feel the vibrations instead of your symptoms. Transcutaneous electrical nerve stimulation (TENS). With transcutaneous electrical nerve stimulation, the device sends small electrical currents to parts of your body to help relieve pain. There's not a lot of research on the use of TENS to treat R.L.S., but it could work. Studies have shown that regular use of TENS along with vibration treatments can relieve R.L.S. symptoms. Acupuncture. Acupuncture can be helpful in the treatment of many health conditions, with R.L.S. being one of them. Studies of people with R.L.S. who were treated with acupuncture showed that their abnormal leg activity from R.L.S. was greatly reduced. Mix and match restless leg syndrome treatments. What works for one person isn't necessarily going to work for someone else, so take your time trying some or all of these natural remedies for restless leg syndrome. While this condition isn't likely to lead to a life-threatening condition, it can interfere with your quality of sleep, which will have a negative impact on your daily life. The more natural remedies you can implement into your daily life, the more likely you are to eliminate the discomfort and get your sleep schedule back on track. Medication therapy. If you have R.L.S. without an associated condition, and natural treatment and lifestyle changes haven't been effective, your doctor might prescribe medications. Several prescription medications, most of which were developed to treat other diseases, are available to reduce the restlessness in your legs. These treatments may include the following. Medications that increase dopamine in the brain. These medications affect levels of the chemical messenger dopamine in your brain. These medications include ropinirole, Requip, rotigotine, Nupro, and pramipexole, Mirapex. All these medications are approved by the Food and Drug Administration for the treatment of moderate to severe R.L.S. There are some short-term side effects with these medications, but are usually mild. These include nausea, lightheadedness and fatigue. Beware, they can also cause impulse control disorders, such as compulsive gambling, and daytime sleepiness. Drugs affecting calcium channels. Another drug that's been approved by the FDA to treat R.L.S. is called gabapentin Horizont. This is an antiseizure medication and pregabalin Lyrica. Opioids. Opioids are typically used to treat pain. In some cases, usually when other medications aren't helpful or cause augmentation, opioids can be used carefully in low doses to help treat mild to severe symptoms of R.L.S. But caution should be taken as they may be addictive if used in high doses. Medications include codeine, oxycodone, OxyContin, roxicodone, combined oxycodone and acetaminophen, Percocet, Roxicet, and combined hydrocodone and acetaminophen, Norco, Vicodin. Muscle relaxants and sleep medications. Known as benzodiazepines, these drugs may help you sleep better, but they don't eliminate the leg sensations, and they may cause daytime drowsiness. A commonly used sedative used for R.L.S. is clonazepam, Clonopin. These drugs are generally only used if no other treatment provides relief. It may take several trials for you and your doctor to find the right medication or combination of medications that work best for you. Caution about these medications. Most drugs prescribed to treat R.L.S. aren't recommended during pregnancy. Some medications may make symptoms worse. These include some antidepressants, some antipsychotic medications, some anti-nausea drugs, and some cold and allergy medications. Sometimes dopamine medications that have worked for a while to relieve your R.L.S become ineffective, or you notice your symptoms returning earlier in the day. This is called augmentation. Your doctor may substitute another medication to combat the problem.